Hello everyone, my name is Hazel Avalos and I'm a student at Grand Canyon University in the College of Humanities and Social Sciences, currently pursuing my bachelor's degree in Behavioral Health Science. This presentation is for my Ethics of Behavioral Health Science course with my instructor Larissa Zemensky. In this presentation, I will explore how my personal motivations for entering the mental health field, along with my lived experiences, values, and professional background, influence the way I may work with future clients. I also examine both the strengths and potential challenges these factors may bring to clinical practice. I understand that self-awareness is essential to ethical clinical practice. As Fisher explains, clinicians must continuously examine how their personal values, beliefs, and biases influence their professional behavior. Without this ongoing reflection, there is a risk of unintentionally harming clients or limiting treatment effectiveness. In this presentation, I explore how my motivations for entering the field, along with my personal experiences, values, and assumptions, can influence my clinical work. I also consider both the strengths and the risks these factors may bring to my future practice. My decision to enter the mental health field is shaped by both personal and professional experiences. Living with a misdiagnosed ADHD diagnosis, which was initially treated as anxiety and depression, played a significant role in inspiring me to explore mental health more deeply. That experience helped me understand how easily symptoms can be misunderstood or overlooked, and how important accurate assessment is for effective support. It also motivated me to continue learning so I can help others better understand themselves and feel validated in their experiences. In addition, my work in crisis and triage settings, as well as adolescent substance use prevention, has strengthened my desire to support individuals in difficult moments. As Norcross and Lambert emphasize, personal experiences can strongly influence the therapeutic relationship, making ongoing self-awareness essential in clinical practice. I recognize that my personal and professional experiences together can both strengthen my clinical work and create blind spots. Because of this, I plan to regularly seek supervision and engage in self-reflection to ensure I'm not projecting my own experiences or expectations onto clients. Maintaining my own mental health and practicing ongoing self-care will be essential so that I can show up fully and ethically for the individuals I serve. I believe my motivations and values can positively benefit my clients when they're used thoughtfully and ethically. I value empathy, respect, authenticity, not judgment, and cultural awareness, all of which help me create a safe and supportive environment for clients. My lived experience with mental health also allows me to approach clients with genuine understanding and compassion. In addition, my crisis and triage experience has strengthened my ability to remain calm and present during high-stress situations. As Norcross and Lambert highlight, the therapeutic alliance is one of the strongest predictors of positive outcomes. When combined with ongoing reflection, this strengthens can enhance my ability to provide effective client-centered, as Fisher emphasizes. At the same time, I recognize that my personal experiences and values may create potential risks in clinical work if I am not intentional about managing them. Because I have lived experience with anxiety, depression, and ADHD, I may be more vulnerable to over-identifying with clients who share similar challenges, which could impact my objectivity or blur professional boundaries. While my empathy is a strength, it could also lead to emotional over-involvement. Additionally, my crisis and triage background may lead me to focus too quickly on problem solving rather than allowing clients space for processing. Fisher emphasizes the importance of avoiding value imposition and maintaining ethical boundaries, which requires ongoing reflection and supervision. I understand that my motivations, values, and experiences directly influence how I approach treatment. On the positive side, my empathy, lived experience, and crisis work background can help me build strong rapport and remain engaged with clients, especially in emotionally intense situations. However, I also recognize the risk of unintentionally projecting my own experiences or assuming I understand a client's situation based on similarities. This can lead to biased interpretations or subtly influencing treatment directions. As Corey explains, the therapeutic relationship is powerful, but must remain grounded in the client's goals rather than the clinician's assumptions. To maintain ethical practice, I must consistently engage in self-monitoring and supervision. I understand that transference occurs when clients project feelings, expectations, or patterns from past relationships onto the therapist. As Corey describes, this process can provide valuable insight into a client's relational history and emotional world. However, I also recognize that transference can distort the therapeutic relationship if it is not identified and managed appropriately. In my role, it is important that I remain aware of these dynamics without reacting personally or reinforcing inaccurate perceptions. Instead, I need to use transference as a therapeutic tool while maintaining clear professional boundaries and supporting the client's self-awareness and growth. I also understand that counter-transference involves my emotional reaction to clients, which may be influenced by my own history, values, and experiences. Fisher and Hayes explain that countertransference is not inherently harmful and can actually provide useful clinical insight when properly recognized. However, if I'm not aware of my reactions, they may interfere with my judgment or lead to inappropriate emotional involvement. Because of this, I must actively engage in self-reflection, supervision, and consultation. This allows me to ensure that my responses remain professional, intentional, and supportive to the client's therapeutic process. I recognize that my personal values and biases inevitably influence how I perceive and interact with clients. I value empathy, respect, honesty, and cultural awareness, which support my ability to provide compassionate and inclusive care. However, I'm also aware that implicit biases may still exist, even when I intend to be not judgmental. Sue emphasizes that these biases impact clinical judgment and client experience if not addressed. Fisher also warns against unintentionally imposing personal values onto clients. To ensure ethical care, I must remain open-minded, reflective, and committed to understanding perspectives that differ from my own. I understand that managing personal bias is an ongoing professional responsibility rather than a one-time effort. Fisher emphasizes the importance of continuous self-reflection, supervision, and adherence to ethical guidelines. I plan to engage on ongoing education to strengthen my cultural competence and clinical skills. I also recognize the importance of seeking feedback, consultation when I am uncertain about my reactions or decision making. By actively monitoring my thoughts, emotions, and assumptions, I can reduce the impact of bias on treatment and ensure that I'm providing ethical, respectful, and client-centered care. In conclusion, I recognize that my personal experiences, values, and motivation play a significant role in shaping my clinical identity. While these factors enhance empathy, strengthen rapport, and improve my ability to connect with clients, they also represent risks if I do not remain self-aware. Ethical practice requires continuous reflection, supervision, and a commitment to growth. By understanding both the strengths and limitations I bring into the therapeutic relationship, I can also provide more balanced, ethical, and effective care. Ultimately, my goal is to ensure that client needs maintained at the center of all clinical decision making.